There's no doubt grief brings change. It changes our lives, it changes our routines and our plans, and it changes us. Even change by choice, as in weddings or new homes or new relationships, brings stress with it. But the change is not by choice, such as grief, can leave us feeling so battered. Today we're going to explore how grief changes us. And at the end of this video, I'm going to leave you with two really important questions. My name is Jo McRogers, and I'm a therapist who supports grief through this YouTube channel and through my private therapy practice. Please help YouTube recognize that grief support is important by subscribing to the channel, liking this video, and turning on the notifications bell. When grief shows up in our lives, sometimes the earliest question is, how do I get back to normal? When grieving, however, I would ask you to consider the filters of now and the future. So first, let's talk about how grief changes me now. Grief can bring changes in sleeping, eating, overall energy, personality changes, such as being more irritable, having no patience, or no longer having the tolerance to other people's small problems. It can involve forgetfulness, trouble concentrating and focusing, problem solving. Sometimes we become more isolated, either by choice or through circumstances. We can often feel like an outcast. There will be relationship changes with family and friends as they are reacting to who I am as a grieving person. We can feel more anxious or afraid of the future, fearful, and wonder what's happening next or where we go from here. We can often wait for the other shoe to drop, more bad news. In our body, inflammation happens when our immune system responds to something that it experiences as a threat. It makes the tissues in our body swell, and it can play a role in serious things like heart disease and diabetes, asthma, and then possibly cancer. There's evidence that grief is linked to this inflammation, and some studies show that the more severe the grief, the more serious the inflammation. Grief shows up in our immune system. Our immune system becomes compromised. There's some evidence that grief can take a toll on our body's ability to fight illness and infections. So some people will catch colds or come down frequently with the flu during times of stress, and this is certainly true while grieving. There was a study done in 2014 that found that older adults who were experiencing grief specifically due to the loss of a spouse, that these older adults could not maintain a stress hormone balance. And then as a result of that, they were less likely to produce some types of white blood cells, which left them vulnerable and prone to infections. Grief sometimes is science, and not always just in our heads and our hearts. Anxiety presents itself. The events that cause grief can make us feel like we don't have control over our lives. We then can get concerned about our finances, about our future of being alone, or the possibility of losing somebody else that we love. Anxiety is sneaky. We can physically experience a cortisol rush. Cortisol is sometimes called the stress hormone, and our bodies may release more of that than usual into our bloodstream for months after our loss. High levels of cortisol over a long period can raise our chances of heart disease or of high blood pressure. Then there's the broken heart syndrome. This is a real syndrome. The sudden loss of a spouse or a loved one can cause a jolt of intense emotion and trigger hormones that lead to sharp chest pain and trouble breathing. Many people really do believe that they are having a heart attack. Our hearts may actually physically not pump blood as well as it can. This situation can call for medical attention. And then there's digestion. Grief can lead us to stop eating on a regular schedule because we lose our hunger cues, or we can binge eat. Our hormones that bring this can make us feel nauseous, upset our digestive tract. Many grievers can also find it difficult to identify a reason to maintain their health. Grief brings us aches and pains. We are more likely to have joint pain, back pain, and headaches when we are grieving. Part of the reason for this could be the muscle tension that is caused by the stress hormones in our bodies. We experience functional impairment. Anxiety and stress resulting from extreme grief can cause us to have impairments in our concentration, in our decision making, in our judgment, and even physical boundaries. We can bump into things walking through the room. It can be hazardous to our health to do normal activities such as driving. Lots of people speak of being fearful of driving. Occupational hazards then increase as well. It's as though we lose the sense of our bodies. Substance use and abuse increases, self-harm behaviors increase, and thoughts of ending our lives can increase. Grief is very physical. Multiple studies have found increased rates of mortality amongst the bereaved. And then there's the big scary experience of while being at our lowest emotionally, we may begin looking closer at our own mortality or the mortality of others that we love. It is important to know and reassure yourself that these are the changes for now, the earlier stages of grief. With time and grief work and community and support, these states will change. So next, let's talk about the concept of how grief changes us forever. Most grievers will forever feel that a part of them is missing. This can remain an everyday feeling. Many grievers will carry at least some part of the trauma that surrounds even anticipated or expected loss. And most grievers always feel a little bit broken or wounded in some way. For some, the fundamental change in how they perceive the fairness of life, worldviews and assumptions can now be broken. Old beliefs such as I'm safe, it is safe to love, I can take risks, I deserve joy, I have control, I have faith or religion or spirituality or my culture to guide me and comfort me. My friends and family know me so well, they'll know how to help me. All of these and more may not be accessible or true for you anymore with this grief in your life. Sometimes grieving brings us an opportunity to feel closer to others, especially those friends or family who have really shown up for us. Sometimes it comes from others who have experienced grief themselves. Our perspectives about relationships may now change too. New friendships that may develop because of this loss or through this loss. It could be a coworker or a neighbor who unexpectedly reached out and really connected with us in a supportive way. We may develop a filter of no longer sweating the small stuff, or a filter of having a much deeper understanding of what really matters, of what is important to us in the big picture. Surviving our grief can show us a strength and a resilience and an independence that we may not have known that we actually held. It can create opportunities for us to surprise ourselves with the things that we can do and the things that we can endure. After caring for my mom to her last breath, I really gained a belief that I can do anything now. Our loss will also forever be a before and after timestamp. This doesn't necessarily change with time. Was that before or after the diagnosis? Was that in the hospital or was that in the hospice? Was that before or after Grandpa passed? These are the questions about timestamps, the before and after. So please consider using the now and the forever references when talking about navigating your grief. So let's go right back to that early question of, how do I go back to normal? While this is a totally normal, natural question, it is also the most futile task of grieving. Us pining for things to go back to the way they were is a misguided longing. To expect ourselves to be the same person after we've lost someone that we love is an unfair expectation. How many of you have struggled and hoped for this to happen? Please leave a comment below so that we can all identify what a normal grief quest this is. I cannot emphasize enough that what has happened to you is important enough to change you. So rather, I would ask you to entertain these two really important questions. Who am I now with this loss? And how will I choose to live with this grief? These are the really important questions to ask yourself. Now, of course, timing is everything, and that includes grief. These are not early grief questions. It is important to let grief, reactions and responses, and your brain protect you to rehearse and react. And then several weeks or months later, you can imagine planning a response. Please see the video that I made that talks about the difference between reaction and response, and I will cue that up to watch right after this video finishes. But at some point, while trying to integrate your loss into your life, these two questions play a pivotal role. So here is my radical suggestion. Grief is a transition from who you were to who you are now with this loss. So take that in. Grief is a transition. It isn't static and it isn't fixed. It's important to know this even if you can't feel it or comprehend it or trust it yet. This is not to imply that you needed this grand life lesson so your favorite auntie died. I believe that this is more about the sentiment of don't waste a good crisis. You can endure the crisis, or you can endure the crisis and just try to wring out any gathered wisdom that you can. So here is your project. Pen to paper and ask yourself, who am I now with this loss? How will I choose to live with this grief? Your answers are definitely going to support this transition of grief that you are experiencing. So any thoughts or comments, please leave them below for all of us to learn from one another. If you wish to learn more about joining my new platform that explores more questions like this about grief, please let me know where to send the updates to. You'll find the link in my comment below and in the description of this video. As you do this critical observation and learning about yourself and your grief, I send to you kind thoughts, kind words, and a kind heart. Thank you and take good care.